Okay, I hope this is working. Let's have a look. Yay. Welcome, 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 welcome. Is it working? Welcome to the Chinese Medicine Podcast live stream. I think it's working. Let me just check. Yeah, I can see the audio is working. That's good. So today we're going to be answering some subscribers' questions about what's the difference between classical Chinese medicine and well, let's just say TCM. Not just that question because that's a bit broad and basic, but oh, my mouse has just suddenly capped it. Not a it's not a happy camper. What? Why won't you work properly? So what I want to do talk to you about is answering Teacup's question, which I can't even find. I'm just going to have to grab something very quickly. One second. When in doubt, change the batteries. Got this new Mac, and I have a feeling that it's draining the mouse batteries like you wouldn't believe. I can't exactly know that it's that, but I'm just going to check it now and see if that's the reason. Other than that, no complaints about this computer. It's such a great computer, but I think it's chewing through the mouse batteries. Okay, so what we're going to talk about today is classical Chinese medicine. To answer the question, now some people wanted to know about acupuncture and classical Chinese medicine. What's happened here? No data. What does that mean? Here we go. Connected. Awesome. We're back in business. It was the batteries. Stupid batteries. It's life, isn't it? It's always the batteries. Okay, so I'm going to get this question here. Yeah, so if you've got a question, pop it in the comments below and we'll have a little chat. This won't be super long. Well, it might be if people want to chat more and more. But yeah, share the stream if you know someone who's studying Chinese medicine and they'd like to know more about it. Still not sure what's the best time to do these things. We'll just give it a try. I like doing streaming now. I've done like 3 of them. This was my 3rd one. So I like the interactiveness. Last time there was quite a few people popping their questions on towards the end. So that was good. So to answer the question about does acupuncture have a classical system, let's say, as well? Well, yes, it does. And yes, you do learn that in TCM School. So the reason why I wanted to jump on and make this video was that I'll just read what you've put here. So you said you guess you're lost when it comes to moving forward. Are you wondering whether there are degrees in just acupuncture without the herbal? And that's, yes, there are. Yes, there are. So if you're on this stream, if you do jump on this stream, Teacup, then let me know in the comments. We can have a bit of a back and forward. There are lots of courses in Australia that, like, so Endeavour College is a college that just teaches acupuncture. And I think there's another course which is just acupuncture, Sydney Institute of Traditional Chinese Medicine. I think they teach an acupuncture only degree as well as a herbal medicine degree. I think people can choose what they want to do. Yeah, all right. Oh, great. So what country are you in? Do you mind mentioning that? I think you're in Australia. Teacup. So, and just maybe tell me, have you started studying already? Have you started studying acupuncture? Because I thought you were a student already in my mind, but that's probably because I just read things and infer the rest of the information from there. So look, it's not a lost cause just studying. It's not a lost cause just studying what's available. Okay, so unfortunately, there isn't an undergraduate course in classical Chinese medicine. Right, waiting for clarity. Yep. Look, I'm a big believer in just getting started. Every day goes past, and this isn't Chinese medicine, this is just me. But like a day goes past, a week goes past, a month, a year. Next thing you know, it's the next year. And I understand that it's expensive, and it's like when I was studying Chinese medicine, it was also it it wasn't as expensive as it is now, but it was still relatively expensive. Like I was constantly selling my car to pay for my school fees because there was no HEX system back then, or PEL system, or whatever they call it now. Like for Chinese medicine, I had to study it at a private college because I didn't want to move states. There was lots of reasons why I did the way that I did it. But hey, banana shout out reporting. It is shout out. Because when I read your name, I wasn't sure it was like banana choco out. Like I can't read it properly. So when I was studying Chinese medicine, it was hard because it was monetarily hard. It was like, and I didn't know there was other things around. And I think also I've mentioned this before when I've talked about classical Chinese medicine versus TCM. It's only just come out now. Like it's only not just come out now, but it wasn't a thing that back then. Like I thought that was the best things ever. Like I didn't realize there was something better. And there's a few reasons why classical Chinese medicine's made a bit of a resurgence in the last, let's say, 10 years, I would say, because courses just didn't exist. And one reason is because of the internet, because of people being exposed to, like one teacher can then be like for instance, you guys watching me on this YouTube video, like that wouldn't have been possible, even 10 years ago. The internet infrastructure wasn't there for YouTube to work properly, like it does now. And it just wasn't even there. So you weren't exposed to these different ideas, and you would have had to travel, literally travel like into the into the jungle of China kind of thing, into the, the mystical place where you don't know what you get, and so let's not have a ramble, Murray. But yeah, so I guess what I thought I'd cover in this stream to answer your question pretty much, Teacup, is what you would learn in Chinese medicine undergraduate school that's not wasted, right? That's as in, so one is you get a degree and that will allow you to practice. So in Australia, you really need to do some kind of course ethically, but it is registered with AHPRA. And there are some people that don't register with AHPRA and they can still practice, but you can't use the title acupuncturist. And you can't, so some people are still practicing the practice of acupuncture, but it's very hard. And the insurance has actually become really hard this year. I've got a few colleagues that, been discussing this kind of with back and forward, looking for ways, around it for different reasons, not for myself, but for other people. And it seems like it's just suddenly become really increasingly difficult if you're not registered with AHPRA. So therefore, you need to do a recognised course. So yeah, that's one value of doing it, right? So what do you study in Chinese medicine school? You study the basics, the foundational stuff, like the foundations of Chinese medicine is one of the first units you'll do. And that kind of covers like yin yang and the 5 elements. It covers what are the concepts of disease and how that kind of arises. And then the second half of that year, first year, you do a course. Like I can only talk about the stuff I teach at Endeavour, and I've taught like so many different units there. It's actually very similar to the college where I studied, and I also taught at that college too. It's not like a really dissimilar course to what's around in other places. If I'm too loud or too soft, just let me know, because I've turned the volume up a tiny bit on this thing, and I don't want to be hurting your ears with the loudness, or it's too soft. So just let me know if there's any issue with the volume. So I guess what happens is you do that foundations, and then you do this next unit, which is kind of like expanded on that, but like how does disease, like what we call patterns of disharmony, right? And it could be in other universities or colleges, it could be in different places, but typically what you'll learn. Oh, it is a bit soft. I can turn it up. I've got a volume knob here. I'll just turn it up a tiny bit because it is a bit quite sensitive. Well, I'll turn it up a bit more. just check on my thing. Hopefully that's okay, because I tend to talk a bit loud sometimes. A bit loud because I'm a loud person. Awesome. So what can happen? So what I'm saying is within that unit, okay, perfect, great. I'll just make a note of what that level is, number 5. I don't want to move it too much because I might might discombobulate this whole system, these things that are plugged in to make it work. So within that unit, like the second half of that college unit, you learn some of the basics of what would be called the foundations of classical Chinese medicine. So you do like it's actually like the college I studied at, and Endeavour is very similar, right? It was like a 3-hour class on the Shanghan Lun, maybe a 6 hours if you're lucky, and then a 3-hour class on the Wenbing, right, which is the system that kind of followed on from that. And then look, those things aren't just dismissed, but one of the problems with classical, I'll tell you a couple of reasons why it's not taught as much within the college courses, within the stock standard curriculum, let's say. So, for instance, the Shanghan Lun is mostly a herbal text, but there's a lot to understand about how the body works, especially within the 5 elements, and which you can apply to acupuncture because it's just applying it to physiology, and it probably applies more to diet therapy and the longevity and like how do you keep your body healthy and all that a lot more easily than with acupuncture. But there's so if you're studying an acupuncture degree, let's say, there's kind of like they're not going to teach you about herbal formulas in depth. Because why would you learn that? You're not practicing herbal medicine. So like, let's say at Endeavour, and a lot of colleges kind of do this, they might have some units about herbal medicine, but you're not coming out as a herbal medicine practitioner. You're not going to be able to register in Australia, let's say. And even in the US, they have these kinds of courses like this. Like it'll be an acupuncture degree, but you might learn about herbs as an elective. Why would they teach you that? Well, for some people just to wet your whistle and sort of think, maybe I'd like to be a herbalist as well later on. To be able to prescribe what they call patent medicine. So that's like pre-made medicines, right? So herbs that are already made as a pill or powder or something like that, which would technically, it depends on the law in your country, but technically not dispensing the herbs would be that. So that's one reason why the Shanghan Lun, I would say, isn't expanded upon much in undergraduate schools of acupuncture, because kind of it makes more sense to talk about herbal medicine. And then like with acupuncture, it's only been, and the same as with herbs, right? It's only really been recently that there's people like, I don't want to say this like arrogantly because it's not about me being better than other people or anything like that. That's not what I mean. Like there's not many practitioners in Chinese medicine who are equipped to properly teach classical Chinese medicine, because you kind of need to be like, it's not got to that point yet where it's so prolific it's not been taught so much that you've got a lot of people kind of knowing it. The people who would know it and teach it well and who are good at it aren't very many. So many of those teachers, now not all of them, some of them teach in undergraduate schools as well. And I'm not saying I'm a classical Chinese medicine teacher. I'm not. Like I'm just saying I've been exposed to that style, and so that's what I practice in my practice. But it's you're kind of committing to a life of scholarly understanding. So one of your parts of your questions was that you said, like, will it all be a waste? Something like that. Like if you go down the road, you study Chinese medicine, you think, well, what portion of it isn't aligned with what you're actually going to be practicing? Not all of it, right? So what will happen is when you're in first year Chinese medicine school, you get a taste of these different things. And a lot of students then, when they're in first year or second year, they might come across a particular, it's not so, it is a little bit exclusive, but it's definitely more open to people to learn it because of the internet, right? People can find teachers, they can find schools, and they can find ways of learning it. And there's ways of learning stuff alongside when you're studying as an undergraduate student. And I've seen well, say for instance, my one of my teachers in the UK, he's amazing at classical Chinese medicine. Like, just got got an amazing memory, but he was exposed to it a lot earlier than lots of others. So he was exposed to it as part of his undergraduate training. Like, I think he sort of met his teacher as in that time. And so, the longer you're kind of exposed to something and the more you've been doing it, the better you're going to get at it by the time you've graduated, right? So you might sort of have a bit of an inkling that this is what you want to do, and you think, okay, it's not that other stuff is a waste, but look, there's lots of stuff in degrees that are taught now that you're not going to practice when you finish. And certainly with Chinese medicine, it's one of those things where, like, some practitioners, acupuncturists, let's say, they end up just doing like Dr. Tan style, and they do it really well, and they make a great practice and a great living out of that. Now, does that mean that all the stuff that they learned about I don't know, like infertility disharmonies, not that Dr. Tan can't be used to treat that, but like the Zhang Fu diagnoses that are taught so heavily as part of pattern differentiation, is that wasted? Well, it's not really utilized, but it doesn't mean it's kind of completely wasted. So it's not like what you're taught in undergraduate TCM school's rubbish and, now you're going to learn the real good stuff when you get to classical Chinese medicine. I shouldn't have maybe given that impression. It is different, but you still need to learn that, because most classical Chinese medicine schools that are training people in it, they're training existing practitioners. So you need to have already done the degree at the start. There's nothing. I get that you don't want to waste your money and your time, because I'm like that too. I wouldn't want to waste money and time on something. But at the moment, there's no other way around it, and you have to sort of think, well, what are you going to do with your life? Are you going to just wait for something better to come along? What if it doesn't? What if 10 years, 5 years goes past and you kind of haven't bitten into it? Now, people can go through Chinese medicine school and come out and not be very good at it, right? Because they can get their degree, but they're not a very good practitioner because they didn't apply themselves so much, right? But they can still pass the exams. They're like a just getting by kind of person. Now, what's great is that Chinese medicine tends to not attract those kinds of people because it's hard, and when you get out, you've got to mostly be self-employed, although there's heaps of job opportunities in it now, particularly Melbourne and Sydney. I see practitioners advertising for practitioners all the time. And it's like any profession. If you are good, if you've got a bit of charisma, if you've got a bit of, you don't have to be bombastic charisma, but you've just, you've got that personality that you can get along with people, and patients kind of you're a warm person to the patients and things like that. Like, that is really beneficial, right? And so I've seen some practitioners that aren't that good scholarly, right? But they get better over time. And no matter what you study, like whether let's say you could find a course in classical Chinese medicine, you'd still graduate and still be needing to study at the end of it. And hopefully you'll start your business or start your practice, and it'll be so lucrative, like in terms of financially beneficial to you, that you'll have the money as part of your business. You'll have money to be able to invest into your ongoing education. So once you've graduated, I get that you've got to pay off all the debt of being a student, or maybe you don't, but maybe the government's going to hold that for you for a little while. But so what would you kind of learn that you might not use? Well, look, the diagnostic system of the Zhang Fu diagnosis is just so heavily implemented, let's just say, in most schools. Not all, but what happens is they teach you these different kinds of methodologies of how to make a diagnosis. So 5 elements is one system, Shanghan Lun is one system, Wenbing is another system, Zhang Fu diagnosis is another system. So this is the kind of things you learn in the first year. It's kind of like a smorgasbord, right? Now, why do you pick one system and not another system to treat in the student clinic? So by second or third year, you're going into student clinic. And at the same time as doing that, you start to study different units, like you study like, let's say, like specialty I've just touched the microphone, sorry about that. Specialty areas of Chinese medicine. So let's say things like gynecology. So what do you learn in that? Well, you learn about what are the various patterns of disharmony that you would have already learned in first and second year, or first year. But how do they apply to someone with gynecology, like gynecological issues? So let's say a person with infertility, or a person with PCOS, or period pain, or these kinds of things, right? Then you do like a unit in dermatology, or it might be a whole unit, might be like 3 or 4 weeks, and then ear, nose, and throat disorders. So what do you do in those units? You kind of revise over the TCM theory that you should already know, right, from first, second year, but obviously students don't remember everything from that. And then you go through like how to diagnose, like what's the different patterns of disharmony within that, right? So let's say in something like ear, nose, and throat disorders, in first year you would have talked about like things like called a wind cold or a wind heat. Now I hope I'm not going over people's heads here. Like you're just like, whoa, Maria, I wasn't expecting this. This is more of a stream for people who are into studying it and students and stuff. But I'm sort of talking about what you would learn if you just jumped on the stream, what you would learn as a student of Chinese medicine, and how does that kind of compare to what you would actually practice if you decide to go down the classical kind of road. So let's say you're learning about ear, nose, and throat disorders. Now, one of the disorders that's common might be like an ear infection. Yeah, great. If I start to ramble too much, just keep me on track and just tell me. So what I'm getting at is the first year theory that you learn. If people actually learned it and thought it through and applied it to these disorders, you could already come up with the answers in a way, right? You don't need a book to tell you, these are the different patterns of disharmony that are seen in, earache, let's say, or like otitis media is the name of the disease or the condition. And then you also go through in those units, how to diagnose that, what are the signs and symptoms and the pulse and the tongue for that particular pattern. You might practice a little bit of tongue and pulse diagnosis in the classes. Don't hold me to this because different schools teach these things in different ways, but roughly this is kind of what you do. And then you might not physically do that diagnosis because you're in a theoretical class, right? And so you're kind of discussing that and doing that. And then what you'll do is you'll go through different treatments. So alongside of learning this would be sort of second, third, fourth year that you do these different classes of different types of styles of, well, not styles, but different conditions. Like how does Chinese medicine apply to these different conditions? So if you're in a herbal medicine degree, you'd be learning what formulas would you use? Like would you use, and so you might see Xiao Chai Hu Tang mentioned like for earache, but then you're like, oh, why is it here in infertility? Why is it here in this? Because it's not an infertility formula or an otitis media formula. It's a formula that harmonizes the Xiao Yang. So how does it work in those ways? So that would be something that's part of classical Chinese medicine. It's also the underpinning idea of TCM, right? Traditional Chinese medicine. And then you also, alongside of that, you start learning like what's called channel theory. So for an acupuncture degree, you have to learn the channels first. So there's 12 channels on your body. You have to then learn point location. So I think they teach this in first year, maybe started in first year as well. So one whole 6 months is on channel theory. So you're memorizing the channels, you're learning the channels, what do they do, where do they go? And that is really a big part. That's a massive part of classical acupuncture. You need to know that stuff. And then you start learning points, like where are the points? So you have to find, that's a big thing just to memorize, right? Like it's something that I just sort of take for granted now, but I see how hard it is when I think back to the days when like my teacher would maybe say, okay, like you're in the student clinic and the teacher would say, okay, do these points on this patient, and you're just like, okay, and you couldn't remember where's like where's lung 7 or where's white 1 or something that you've been told to do. And you'd be just freaking out. Now, there was no apps and phones back when I was doing it. So you'd be just like, get this massive textbook and try to look through it and try to find where the point is. So that's a big part of it. You have to memorize all that. So that probably takes you like a good 2 or 3 years to kind of get a handle on memorizing that, right? I'll get to your guys' questions in a sec. I just don't want to sidetrack myself too much from this train of thought, because I tend to do that a lot. And then, not that you're distracting me, I mean, I distract my own self. So you're learning that, and then concurrently, like at the same time, you're learning Western medicine stuff as well. So a third of the degree for most undergraduate degrees in Australia is on Western medicine based subjects. So you've got bioscience, which is like, so this starts in the first year. You've got like anatomy and physiology. Then you've got like pathology, which is just diseases. So that there's nothing to do with Chinese medicine. I remember sitting in my classes going, oh, I hate this. I've just got to kind of grin and bear it. I'm never going to use it. It's good to know it. You need to know it for understanding the human body, and you also need to know it for communicating well with your patients. But then it kind of comes in even more so when once you've accumulated all this knowledge, or you've been exposed to all this knowledge. So my teacher, one of my very first teachers, Wade, said this to me in the first year. He said, like, Chinese medicine and Western medicine are like two different systems. So you need to put your Chinese medicine hat on when you're thinking about Chinese medicine. And then you take that off, and then when you get into your Western medicine class, you need to put that Western medicine hat on. Don't try to merge the two together. But there does come a point where, hopefully, like for me, it was probably 5 years after practicing, where I allowed myself, because before that I refused to think about the two together. It was kind of like, these are two different things and never the twain shall meet, because that's what he'd said to me, and that was very wise advice, and that really helped me understand both systems without getting, because it's incredibly confusing when someone says, oh, but what about my liver? Oh, does that mean I've got a gallbladder problem? Does that mean I've had my gallbladder out? Does that mean I can't make decisions? Because it relates to decision making in Chinese medicine. Or my spleen, or some patients say, oh, I've had a liver function test, when you tell them they've got liver qi stagnation, and you're just like, that's not the same thing. And you can understand that. I can understand that now very easily and very well, but when I was studying it, it was very confusing. Very confusing. So this is what you're learning. And then so a third of the degree is kind of biomedical and or social science stuff. So depending on the colleges that you study at, you have to learn how to communicate with people, which is important, right? So how do you have, and then a big part of the social science is, and it's also part of the Chinese medicine, some of the Chinese medicine units, where there's just ethical responsibilities that you have. And then there's also legal responsibilities that you have as a student, right? Your whole life is wearing two different caps. Yep. Well, I mean, I wear many caps. Many caps makes a fun life, I think. So that's good. So you learn a lot of stuff that's kind of transferable to other things. So let's say you get halfway through Chinese medicine and you were like, I want to do a different kind of medicine. Well, you've got a good understanding of the human body. You've got a good understanding of biomedicine and disease. And you've also got a really good understanding of how to speak to people and how to communicate. So social science includes communicating with people. So foundations of communication, that kind of stuff. Conflict resolution, anger management, those kinds of stuff, that kind of stuff. And then you also learn like psychology and how to deal with difficult patients. That's like a whole unit at the college I teach at. There's a whole unit on that where they just talk about, what if you had a suicidal patient, a person who's in a crisis? How do you deal with those things? It's just getting more and more complicated in our society because people treat you as a primary healthcare practitioner. And so what's being taught at schools now is probably twice as much as what I was taught when I was at college, in terms of the amount of social sciences that are taught, right? Like, I learned a lot of social science stuff the hard way, unfortunately, just because you're like, well, if I talk to patients like that, they won't come back. If I don't, how are you going to get a patient to get on board with the treatment plan that you want for them? What do you do for yourself as a person, like when you've had a really hard day and you don't want to be really stressed out or end up with this, burnout situation that people say. That's another topic. I don't sort of subscribe to that, but if you don't look after yourself, then you won't be any good to your patients. So that's what you learn. You learn a lot of stuff. And then if you're really interested in classical Chinese medicine, you're an undergraduate TCM student, what I would suggest you do is that you apply yourself as soon as you start learning this stuff in the first year, you start to direct your thinking towards that way of thinking, and you read these other books and you get around other teachers, or you try and find mentors, find someone at the college or the university where you teach that's into this, because there are teachers like this. And when you're at the stage of, like, let's say second or third year, probably more third or fourth year, when you're at the student clinic, you want to try to think about how would I treat them, not just with a stock standard Zung Fu diagnosis, because that's not classical Chinese medicine as such, right? The Zung Fu diagnosis. Now, I am going to talk about acupuncture because it's a little bit different to Chinese herbal medicine. And we'll just answer some of these questions or have a quick look. I'm going to grab a drink. It's Friday night in Perth now. What time is it? 5:19. So cheers, everyone. I'm going to have a sip of cider. So Banana Shoutout says, do you think that reading the classics while being a student, such as the Shanghan Long, will be beneficial? Do the classics require guided reading at the beginning? Yeah. So one thing, and I'll tell you from, just to be honest, lots of people won't say this because they don't want to look stupid. They're very hard to understand books. And that's why I was saying at the start, lots of people don't understand it, and so they don't read it, right? Now, not understanding something shouldn't stop you from reading it at all, but it is good to have a guide somehow. I don't drink, but it's always relaxing when someone opens a bottle. Okay, well, I hope you feel relaxed. I hope I'm not tempting you in the wrong way. This is just a very light alcohol cider. It's more like a soft drink, to be honest. I don't drink soft drinks at all, ever. So just horrible things. Anyway, so what were we saying? What was I saying? Do you think that reading the Shanghan will be beneficial? Right, yeah. So when I was studying, I tried to read the Neijing, which is the main text. So that's the first book you should be thinking about, right? So the Neijing is like the Yellow Emperor's canon of internal medicine. Now, the way to think about these textbooks is exactly like you would think about the Bible, right? So when you are a scholar, a biblical scholar, let's say, you learn a thing called hermeneutics, which is a really fancy word. And that is the understanding of what it's saying in the context and the culture of the time. And like, this was never explained to me when I was an undergraduate student, but I've kind of come to know this by listening to other people talk about it. And a good person that you can follow in Australia, and he has a couple of free things, is David White. I'm just going to put that down in the comments here. Something like Neijing Acupuncture Institute, right? So he's got like one I think is like an introductory course. And David White's, he said he'd get interviewed on the podcast, and I was going to Sydney to do it, and then the COVID happened. And now that I've got this live set up and I can actually use the full capabilities of the internet, hopefully he can get we can do a Zoom recording or something at some time. But he's very scholarly, like incredibly scholarly, right? That's what he does. And he's probably he's the only person that I would recommend in Australia that's, and probably the only person in Australia that's like qualified to kind of teach other people about the different styles of acupuncture, which, like, basically there's one style of acupuncture that's used in stock standard acupuncture, what they call like the normal acupuncture needle that you get, that's called a filiform needle, Well, there's 9 different kinds of needles in the Shanghan Lun. Oh, sorry, in the Neijing. Shit, being murdered saying that. Um, it's not. It's in the Neijing. So there's different kinds of needles, and how you would apply those needles or those needling techniques. If anything, on the overall, like Japanese acupuncture, the style of Japanese, and that's something that you learn usually in undergraduate like school, is probably more aligned to classical acupuncture than the TCM, than the traditional Chinese medicine. I did a video on this channel a long time ago about what's the difference between acupuncture and dry needling. And if you're interested in this kind of topic, maybe check that video out, because I made this infographic thing on it where I had all these circles and different things. And it shows you all the different styles of acupuncture that are in there, right? Now, classical acupuncture is a style, right? It's got its own diagnosis system, right? So pulse diagnosis, which is the wrist pulse, is the main diagnostic system for Chinese herbal medicine. But in acupuncture, there are actually other pulses on the body. So you have a pulse on your neck, you have a pulse on your foot, and so was a kind of a lost art, and that's why I was saying that it's only because recently this resurgence of people doing it to practice it, that it's become available for people to learn it, right? Because this kind of stuff, like learning pulse diagnosis, you just can't learn it from a book. And you can learn it a little bit from a teacher talking to you, like in this situation, like where I'm talking. There's a different level of imparting knowledge, but you still can't learn it properly. You have to be physically with the person that's teaching you how to do that, because there's no training model to sort of go, right, this is what I'm feeling and this is what it is. That's what we kind of need. We kind of need like a little fake hand thing that you can press on and go, right, that's a wiry pulse, and because that's what you're doing on a patient. You're kind of impressing. Your teacher says that's what it is. You're feeling that pulse. Now, now, I just want to preface this with, like, haven't studied classical acupuncture. That's not what I practice, right? I've started doing David White's course very minimally, just little bits and pieces here and there, just to be, because I am interested in it. But I'm not trying to say this as like, oh, I'm the expert on it or I know what I'm talking about. I'm just saying that this is this is out there and this is available. Now, there's quite a few people in the US that teach different classical acupuncture courses as well. And some of those might be available, like a certain percentage or a part of it could be online, but then there'll have to be some kind of in-person training. And I understand, like, if you're thinking, right, I really want to study acupuncture, and you said that I need to do the proper degree, Marie, and then I'm going to have to go and pay more money to do these other courses alongside. It seems very expensive and very time consuming, but these are things where you could probably start to learn some of that. You could certainly learn some of it as you go along, and there's nothing to stop you enrolling in these kinds of courses now. Like, you could start studying stuff that David White's got there. It's not that expensive or anything. It's more like you pay as you go. You pay for a unit. You can kind of, and you're kind of getting let's say a theological understanding, or I don't know if that's the right word. Theological just only pertains to like religious stuff, but it's the theology of it. It's the historical understanding. So what I was getting at before was about, to answer your question, Banana, shout out about, does reading the classics help you? Yes, it does. It's great if you've got someone who can guide you, because part of reading it is the understanding, well, what does that mean? And the person who's not necessarily a historian, but someone who has that, it's not theological. It's probably, something like, anyway, I'll think of the word. It'll come to me. But someone who has an understanding of the culture. It's called hermeneutics, right? The study, that ability to kind of interpret what they're meaning, right? So, if someone has, for instance, I mentioned this on my videos a lot. Like in the Neijing, when it says wood, it means wind, or wind means wood. Well, how do we know that? How are we interpreting that? And so that's where you kind of need someone to kind of guide you. Now, some books have a commentary. So someone mentioned that on the previous live stream. It might have even been Banana Shout Out. You were asking about that Lil something book that was called like Classical Chinese Medicine or something. So often, like there's a couple of Shang Han Lun textbooks that have commentary on them. So they'll have the line, let's say. So that's why it's kind of similar to the Bible, because they've got sort of like, line 100 and it says this, and line, in chapters and lines. And so you can kind of memorize it like that. And then underneath, there'll be different scholars' opinions. Now you have to think, well, one, they're just a person's opinion. They're hopefully an informed opinion, but just because you've written a book doesn't mean that you know what you're talking about. Like anyone can write a book these days. And so that's where it can be a little bit confusing. So it is good if you've got a teacher who kind of guides you and says, hey, these are good books, or these are good people to kind of look at. And sometimes these authors, so Sabine Williams is a good one that you can go on. I'll just put her name here. Who does a lot of classical stuff, translating her things called Happy Goat Productions. And America 429 here. 4:29 a.m. Monty, I hope it's well, I hope you've got a good reason to be up at 4 a.m. Anyway, so Sabine Williams is a good one you can go on, and you can get some articles, right? You can start kind of thinking, how do these people think? Why are they thinking like that? And what's better when you're reading these classical things is to read one thing and really understand it, than try to think, oh, I've got to memorize the whole thing. Or, once I was following a person that I was kind of really liking. Yeah, it's something like that, probably. I'm not that great at people's spellings. Let's have a quick look. I think it's called Happy Go. Yeah, there we go. I'm just having a quick look on the site there. So, yeah. Anyway, you just go to the website called Happy Goat Productions, and I'm sure that there are some bloggy kind of stuff there that you can get your hands on. Yeah, she does have a blog, and that would be something that would be kind of good to follow, because she's well known she's well regarded in this area. Yeah, so it's better to read one thing and really understand it than try and, like I was following a guy once that, won't say who it is, but, he was saying on his thing, this is before I found Arno's course, I've memorized the Shang Han Lun like backwards. And I told my teacher in Perth that, and he goes, who cares? He goes, who cares if you know the Shang Han Lun backwards? Like, it's not about that. It's about, do you understand it? Have you got the clinical application of it? So on one hand, these things are very amazing theoretical texts, but so that some people are very good at the theory of it, right? And so another thing to remember is the guy who's translated the Neijing, the main Neijing translator. Let me just see if I can find that, because I'm gonna. Paul Unschild. That's the one I was thinking about. He's not a practitioner of Chinese medicine. He's not an acupuncturist or a herbalist. He's like a translator. So I'm not saying he's not a good translator, but it's a translation. It's not a clinical manual, okay, of how to apply it. So you do need to read it. You need access to those books, and you should be reading those books. And one thing I'd say is, if you're a student thinking of becoming a student, one thing that really annoys me no end as a teacher is I see students quoting from the Neijing or quoting from Shang Han Lun, but they're quoting Giovanni quoting the Neijing. Like, they're quoting a modern text of this quote. So if you see that quote in those texts, it's great to observe that quote. But what you need to do is then you need to go back and you need to find that original text and read that yourself. Now, it's not hard to do that these days. There's lots of online books, right? If you're in a university, you can get these things online, right? Or you're in a college, you can get access to this stuff. It's not like you have to go out and purchase all these books. But you might have a copy of these things, right? You might have a copy of the Shang Han Lun, or you might have a copy of the Neijing or something like that. Another app that I would recommend, highly, highly recommend, is an app called The Classics, right? So I'll show you, I don't know if you can see this here. Up there, right. So when you click on it, you get this, which is like herbs and formulas and stuff. But one of the things that's in it is the line. So every single line of all these texts. So this is, okay, so Shanghai Lun, will just click on it and I'll show you. So every single line is there, and you can search. You can search the different lines. So you could say, you could just search the word sweating and see what lines of the Shanghai Lun, of the Jingwei, of the, there's a Pulse classic in there as well. Ping Mai Fa, which is a Pulse book. And so if you're into researching a little bit, I think this app is about $80 or something. It's not cheap, but it's the best app. I mean, as a practitioner, I use this a lot because I trust the person who wrote this. So it's just called The Classics. And Simon Feeney wrote this app. And he is the guy that runs Empirical Health. And I'm not getting paid to mention this at all. Like, it's not a sponsorship. I just it's a great app. Because he's very committed to making sure people are doing things correctly in terms of dosages and ratios and preparation of herbs. So particularly if you're like, I want to make this formula exactly how they made it, like I want to boil every herb for the right amount of time exactly correctly, then that would be the app that you would get. And I use that app more than I use the actual text, because I can look something up really quickly, and it's kind of got a really high utility for me as a person who's in the clinic, especially if I want to use a formula that I'm going to give to a patient in bulk, which means like the individual raw herbs, and I want them to boil it a certain way or mix it a particular way. Or sometimes I use that I just use it on myself, because I was sick recently before Christmas, and I was like, I wanted to boil up herbs that I hadn't ever used before, because I hadn't had that sickness ever before. And I was like, how long do I have to pre-boil this herb before the others? These kinds of things. Like, that's where something like that's really useful. So that's called The Classics. That app is really good. And like, for what you get for the money, like, you're basically getting a whole copy of the Shanghai Lun, you're getting a whole copy of the Jingwei, all in there. You don't have the commentary on there, but you don't really need the commentary. You've just got the pure lines, because what I said in the previous live stream was like about sometimes you don't want that commentary when you've got a particular teacher teaching you, because it just interferes with like learning it properly. So yeah, if this live stream cuts out, my camera may cut out because I've ordered one of these battery things that makes the battery perpetual forever going. And I think this battery will last about an hour. So let's see how long it lasts for. But if it does, I might stop and start again if there's still people's questions we haven't answered. So Banana Shoutout says, I'd love to hear more about what you mentioned a few minutes ago, that in the classical way you don't work towards identifying zung fu patterns. In what way do you practice then? Okay, good question. It might be for another video, but I'll try and answer it now. So this is where I can't really answer for acupuncture, because I don't do this for acupuncture. But I could give you an example. So something that I think is missed a lot in acupuncture is this very basic differentiation when patients first come in. And it's not missed so much by practitioners who are in the clinic all the time, because you just kind of work this stuff out for yourself after a while. But when I was a student in the student clinic, it was the same for me, and I see this with other students, that you're thinking everything, you're just framing it in zung fu. So you're thinking like, well, how's your bowels? How's your digestion and your appetite? Because you wonder, what's your spleen chi like? What's your patient comes in and says, I've got a headache or I've got back pain. The differentiation that I'm getting at is it a channel problem or is it an organ problem, right? So that's one big differentiation for acupuncture. Now, over the years, the hundreds and thousands of years of practice of Chinese medicine, like there was a very clear differentiation in the Han Dynasty that some things were acupuncture related illnesses, let's say, or treated with acupuncture. Some things were internal medicine problems, and internal medicine was treated with herbs. And that's still, you can still see that in China today. Like the hospital department's called Neiker, internal medicine, and they don't practice acupuncture in there. They only practice herbs. So if you have gastritis, if you have infertility, if you have even dermatology problems like skin diseases, or like they're just automatically, why would they go to acupuncture, right? But if you had a stroke, if you had pain, if you had Bell's palsy, why would you go to herbs? Like you would, of course you would use acupuncture. That's how they kind of think. And they still think like that now. So, but what's happened in the West is, there's nothing wrong with this. It's just another evolution of acupuncture, I guess, if you like. Now, most patients who come in do have many things wrong with them, most people, because people have been alive for a while. I don't see many infant babies that have just been born, nothing wrong with you, perfect, had a few. And that's why they respond to the acupuncture and the treatments so well, because nothing else is wrong with them. They've just got one thing, right? If a baby's got colic, like it's not a really hard thing to work out how to treat that, because unless there's a massive deformity there or some kind of abnormality, which probably in a Western country that would have been checked already and they would know about that usually, then, it's very simple. It's functional, right? So something has it's not like they've got years and years of illness kind of lying in there. So what I'm getting at is, lots of patients do have lots and lots of illnesses or patterns of disharmony, let's say, not illnesses, going on. So these old people that come in, not old, but these people that come in with the good old, everything's fine, right? I've had lots of patients like that say, how's your bowel movements? Oh, they're fine. And then you find out that they haven't gone to the toilet for a whole week, and they just, that's normal, but that's how I am. That's how my bowels are. So that must be normal, and that's fine. And so, there's a pattern of disharmony there. They might have dryness, or they say they've got diarrhea, and that's just how they have, their bowels are loose every day, and that's just how they are, and they've gotten used to it. So then you might find other things there. But if they came in for a headache, or they came in for their sciatica because they fell over yesterday and they've hurt their back, one is they're not going to be happy if you focus on their spleen chi, right? They want their back fixed. And this can be a little bit annoying for some patients, especially in a student clinic, because the students want to uncover the mystery and get the data, which is fine. But at the same time, you do need to respect, okay, this person's got a back pain. And you could say, hey, look, I can do lots of other things like these things could be an issue for you, or these things could cause you a problem down the road. But their spleen chi deficiency isn't related to their back pain. And so when you ask this question, Banana Shout Out, about if you're not using Zhang Fu, what do you use? Well, for acupuncture, you're essentially using a channel diagnosis. Like acupuncture is redirecting the flow of chi. So there's a blockage somewhere, or there's a lack of flow. Like there's a blockage because there's a lack of flow, or there's a blockage because there's a stagnation. Well, you're removing that stagnation, or you're redirecting the flow, right? You're like a traffic controller, and saying, hey, everybody, stop over here, stop, wait, let these people come through. Okay, now you come, and you're sort of doing that, like in a way, with acupuncture. It's very physical what you're doing on people. And so it's just, you're just not using that kind of, so you're looking at the imbalance from that way. Now, because I haven't really studied a lot of classical acupuncture, I'm not sure how they name those imbalances, like the naming system that's used, but certainly for, like, let's say Dr. Tan method or balance method, that's a channel method, right? You're looking at channels. Did I mention the diet therapy books? Not yet, sorry, Sophia. Missed that, but I do have a video on diet therapy books, actually. I'm sure there's a video that's all right, you're allowed to leave the room. I might leave the room. No, I won't. But I do have a video on books for Chinese medicine. I'm sure I either made a video and didn't upload it about the diet therapy, or that's the one that's on the channel. But there is definitely a video about what books should I read for Chinese medicine. So diet therapy, I think I put the Healing with Whole Foods is a really great book. And then there's another book called The Tao of Healthy Eating. So just to go back, Banana, shout out to your question with the Zung Fu pattern, right? So the reason why you probably learn a lot of Zung Fu patterns in school is because that's what the stock standard people are practicing, right? That's what I was practicing. And I would sometimes think, well, I have to write a diagnosis in this piece, in this part of the page. Like, it asked me for that question, what is the diagnosis? And sometimes it would just seem too simple to say, well, qi stagnation in the gallbladder channel, because they've got, sciatic pain down, or if they had a shoulder pain here, it's a channel diagnosis. So simply you're asking, where is the pain, or where is the problem? And it's just as simple as that. It's not really that hard. Now, the treatment could be a lot more complicated. You're not necessarily doing a local treatment. But with Dr. Tan, he just calls it the sick channel. Like, the diagnosis is the sick channel. It's very simple. And that's a good way to get into the idea of channel diagnosis. Like, look at what's called the Tan balance method. Now, there's variations on that, but just that concept, right, of that the channels are in some way out of balance. And how do we know that? Because there's pain there, or because there's discomfort there, or there's a lack of movement there. So someone might, with a frozen shoulder, for instance, it starts out with pain, and then it's like, oh, now I can't, now I can, I'm just having trouble putting my bra on. But the next thing you know, that's like, oh, I can only lift my arm to this part. Or my favorite one is when you ask the patients, like, how far can you, like, hey, can you get your arm, can you lift it? And they're like, yeah, I can reach it all the way to the sky. They kind of, like, they're going like that to demonstrate like that, but they really can't because they're doing that. Anyway, so herbs, right? Herbs also enter channels. Yeah, and so that's a different thing. Like, in the classical system I practice, like, it's not a part of it. It's something that I think at the very start, something that Arno mentioned, that he was like, it's a bit of nonsense. How do you know the channels, the herbs are getting in those channels? Like, you sort of do by their nature. Like, so for instance, one of the common ones I used to use a lot before I did classical Chinese medicine was like Du-Hol and Sheng-Hol, right? Similar herbs. They're both aromatic. Now, something that's aromatic is going to uplift. So it makes sense that it's going to go up to the upper part of the body, and something that's like heavier is going to go down to the lower parts of the body. Yeah, some of this stuff is hard to, I don't know. I mean, there's lots of stuff in Chinese medicine hard to prove, but yeah. Again, that would be like a person who's like, why would you, when you think like that, you're thinking, why wouldn't you just use acupuncture? Like, yeah, okay, I get that you're a herbalist and you don't know how to do acupuncture. We'll just send them to an acupuncturist. That's what they would do. That would be the most pragmatic way to kind of look at that, rather than saying, oh, I need to kind of redirect my craft to treat something that it, sort of doesn't. Now, you could think, like, I treat lots of pain stuff with herbs. And how do you go about doing that? It's like looking at what's the functional problem of the person, right? Like, so the pattern of disharmony in TCM, let's say if you resolved that, or within classical Chinese medicine, we think of it like in the eight levels, just making things up now, in the 6 levels or 6 divisions, or in the Shanghanlun. So you asked me about what would be the alternative to a Zung Fu pattern diagnosis. Well, there isn't you could say it's a Xiao-Yang pattern, let's say. So someone that's got liver qi stagnation, right? Sometimes it's not, you can't say, oh, liver qi stagnation is equivalent to a Xiao-Yang pattern. It's not exactly, but it could be. It's very common. Now, like, if you had someone who has liver qi stagnation with liver blood deficiency as a pattern, that would be someone that maybe has a pivot between like a Zhuai-Yin pattern and a Xiao-Yang pattern, possibly, something like that. So in a classical Chinese medicine sense, we would think we're treating one thing and not the other. We're not doing the two things at once. Like, you won't see, for instance, a good example of that is like Deng Gui and Chai Hu together. That's in the formula Xiao Ya San. That's treating those two patterns, right? The blood deficiency and the qi stagnation. if this thing turns off, I'll just I'll just chuck another thing in. So don't go away. And I'll have to start another stream, I think. I'll chuck another battery in. So I'll try to finish these questions up. Yeah, so what I wanted to say is the herbal formula name is the diagnosis. So the fact that they need Xiao Chai Hu Tang means they've got a Xiao Chai Hu Tang pattern. That's how it works. It's very simple. And how do you know they need Xiao Chai Hu Tang? Because they have that pattern that relates to like the lines of there's got to be a symptom that relates, or one, or it might be nice if there was two symptoms, but sometimes it's just like one symptom that relates to the use of that formula within the classical text. And they have to have a pulse that relates to that, to a herb in that formula, or a particular, like, so some formulas, like, I'm only mentioning Xiao Chai Hu Tang because lots of people know about that formula. It's very commonly used in both systems, classical, and it's a kind of evergreen formula. It's just it's an amazing formula. It's just got so many different uses for it. So you'd kind of either work out, like, because you're, like, for instance, for my herbal system, we have a way of knowing if a person needs Chai Hu. So then you'd be like, well, because their symptoms are coming and going, that's part of that line 100 in the Shanghan Lun, which is sort of saying, well, that's a reasonable use, let's say, or that's a symptom that relates to the need of that formula. Rather than looking up in a textbook and going, oh, this is a gynecological textbook and here's my top five formulas for treating infertility. That's not how everyone in TCM practices, but it is going that way, where people are sort of like, oh, this formula was shown to be useful in research. Like, well, that's good, but that's not how you should be informing your practice. It's good, it's nice to know that, but that's not how you should be conducting your practice. You don't have a patient that comes in and says, oh, I've got an earache, and you're like, oh, good, I just read a research paper about earaches and formulas that were good in earaches. You should be thinking about, well, what does that mean in Chinese medicine? So in the classical system, it's like, and if they had this ongoing earache that was kind of coming and going, something coming and going, it could fit that Xiaoyang pattern. How did it happen? You might ask them some questions. Oh, well, 2 weeks ago I had the flu. It wasn't very bad. It was kind of mild. It kind of came and went. And then the next thing you know, I thought I was better and now I've got this. And so you could see a progression from them getting like a Tai Yang, a Yang Ming maybe, and then they've got this Xiaoyang condition. So that's how you would make that diagnosis. So then that's because that's such a common formula used in there. Maybe someone has gone and done some research and found that Chai Hu Gui Gan Jiang Tang or Xiao Chai Hu Tang has, been used for those conditions, but that's not how you should sort of be thinking about it. Unfortunately, that's a big problem with the stress that's placed on students these days to find evidence-based. Now, evidence-based doesn't mean necessarily research of modern medical stuff. It means know the classical text, have some evidence, right? You're not just coming up with it out of thin air, which is great. You shouldn't be just sort of thinking, oh, I feel like Hergu or Tai Chung would be good for this patient. Like, these are point names, right? Feel like large intestine 4 would be good for them. Well, it doesn't matter what you feel like, but why are you going to use that point? Or what's the diagnosis, and then what's the treatment principle, and how is that, formula of points going to treat that? That's a TCM way of thinking about, which is very structural, and it's good. It's good to have that methodology about doing that if that's how you're practicing it. So I hope this has been useful and helpful to people in some way. Not too much of a rant. It's Friday night here. I'm going to get on with my painting soon. I'm going to make just got an order of paints, and I'm going to see if I can get on Twitch and make a live stream painting video. But even so, I just want to get on with my paints. Because I had like a house rent inspection and I had to clean up my paint mess. So now I can get all my paint mess out and not that it has to be a mess, but it does get a bit messy. So I can't wait, because I just ordered all these paints and they're burning a hole in my pocket to try out the new colours and the new styles. So you might see some more paintings. I did this one here behind me. Where can you see this? Let me just turn that a little bit on there. Oh, there we go. See that one behind me? That's a spin art painting. So you basically put it on a stick and put it on a drill and squirt all the paint on it. And I saw that on TikTok, and that's how I first started doing the paintings. And then I was like, wow, I'm going to get into this. And then next thing you know, I was getting on YouTube and people were recommended me other things. And then that's how I learned to do the pouring painting. Anyway, so good. I'm glad you guys... So please don't be discouraged about studying Chinese medicine. There's a lot of different ways you can go about it. And yeah, it's like drill painting. Yeah, you go on TikTok and have a look, or on YouTube there's people that have... spin art is what they call it. So you have a big stick and you put it on and you press go, and that does go everywhere. You have to kind of go to a park or have a big area where because the paint can splatter out everywhere. So I can't make too many of those. So I don't have places I can make them in. But yeah, that's super fun. And when I first did it, I didn't have it connected up properly, and it just spun off the drill, like literally just went out into the garden. Yeah. So yeah, look, I think the David White course would be good for you to look at for something. I think he's still got the free thing there, so it just gives you an intro to Neijing acupuncture. And there's other ones. If I think of them or whatever, I'll put them in the comments. But this has been a great little chat. Good luck everybody with your studying and with your endeavors of Chinese medicine. And look, there's heaps you can learn online by that Sabine Williams blog and all the stuff that's there. And then you go down that rabbit hole, and there's just so much. There's lots of stuff you can learn, and the best way to learn Chinese medicine, if you're not a student of it already, is start thinking about how does it work on yourself. It's really something that you would get like a small bit of knowledge, and you start pondering that, and you're thinking over and over that. And that's why I was saying, like, if you say, oh yeah, I want to read the Shanghai Lorna, I want to read the Neijing, think about one or two lines that you've read, and what does that mean? Oh, and the other thing that I used, that people laugh at this, my Chinese scholarly friends will probably laugh. They wouldn't be watching this. But there's a cartoon Neijing acupuncture book. Not Neijing acupuncture, just a cartoon Yellow Emperor book in a cartoon. And that's what I used when I was studying at the start, because I was like, I can't make sense of this. It just was like being on a different planet. And you can still get that book. It's published by a Chinese language press or something like that. But yeah, it's great. It's a great little book because it just kind of explains things in pictorial sense, like little, what is wind, and why is wind causing illness in my body, and what are these different things, and just to gather your ideas about the concepts. So, all right, I'm going to leave it there, and have a great night, everyone, or morning. Some people have logged on from the US that are, it's very early for you. So thank you so much for watching. I think I've mentioned it before. Yeah, I have mentioned it before. I think that little, that book, it's a cartoon, Yellow Emperor. Anyway, take it easy. Yeah, I'm not sure how to every time I've done this, it just ends on me without me trying to turn it off. So I'm going to have to work out how to turn this off. Thanks, Banana shout out. I will have a very happy painting, and I'll see you guys again next time. If you have other questions, feel free to put them in the comments as normal, and I'll think about them and